I'm Grace Woods, and we're back on our podcast, Pregnancy for Pros. This week on our podcast, we will be discussing incompetent cervixes. Incompetent cervixes can also be referred to as insufficient cervixes and cervical insufficiencies. An incompetent cervix is when the cervix, which is located in the bottom of the uterus, is unable to hold the baby properly. The cervix's tissue is too weak, causing the baby to either be born premature or the baby to be lost. Prior to pregnancy, your cervix is supposed to be closed and firm. During pregnancy, the cervix changes shape due to the presence of the baby in the uterus. These changes include in the cervix are opening slightly and getting smaller in length. But within an incompetent cervix pregnancy, it causes the opening of the cervix to open too early and then releasing the baby too early, causing many different complications. The cervix is supposed to open closer to the third trimester, but people who suffer from incompetent cervixes have their cervix open closer in the second. The risk of being diagnosed with an incompetent cervix becomes higher in the second trimester. I personally was diagnosed with incompetent cervix at 24 weeks. People most at risk with suffering from incompetent cervix are people with short cervical length. Short cervical length is when the cervical tissue is unable to stay closed due to not enough tissue length. Because there is not enough tissue length, it is unable to stay sufficiently closed. Studies also show that Black women are more prone to being diagnosed with incompetent cervixes. There is actually no reason why, it is just because. Also, people who receive more than one late-term abortion are at higher risk to being diagnosed with incompetent cervixes. Also, an exposure to a synthetic hormone of estrogen causes people to be at higher risks. People who are also at high risks are people who receive the D&C. This is a procedure usually done after a miscarriage or an abortion. In this procedure, a doctor will scrape the uterus and remove the extra cells and tissues. Symptoms of an incompetent cervix can vary, but many patients who have the incompetent cervix receive the symptoms of backaches, cramps in the abdominal area, pressure in the pelvic area, light bleeding from the vagina, and different discharge from the vagina. How people are diagnosed with an incompetent cervix is usually by a physical exam done by a doctor. In order to determine if you have an incompetent cervix, the doctor will exam either within the late in the second or early in the third. A pelvic exam is done, which will show the tissue if the tissue is short and the cervix is dilated too early or at the right time. Also, another way doctors diagnose incompetent cervix is a transvaginal ultrasound. This is when an ultrasound is taken in order to observe the length of the cervix to make the decision to see if you do have an incompetent cervix. In some cases, incompetent cervixes are not very severe and can be helped with bed rest. In other cases where it is more severe, other treatments may be needed. One treatment for incompetent cervix is cervical clearage. This is a procedure done in order to strengthen the cervical muscles and prevent a premature birth. A suture, or a group of stitches in a row, will hold the cervix together to give it strength in order to hold the fetus better and to prevent a premature birth or loss of the baby. Another treatment for incontinent cervix is the progesterone treatment. This is a hormone that is injected into the body either orally or injected into, and this hormone allows the body to help it complete the pregnancy fully and to strengthen the cervix. This hormone also helps benefit the baby's growth in many different ways. Suffering from an incontinent cervix is extremely hard, especially I know because I suffer from one. But as mothers, you cannot believe that it is your fault, especially if you are diagnosed with this. Pregnancy is hard, yet not everybody understands how difficult it is. If you or somebody you know is struggling with incontinent cervixes or coping with having one, there are many different Facebook support groups that I'll link down below in order to help specific women who have been placed in these hard situations. Thank you again. It's Grace Woods for listening to my podcast, Pregnancy for Pros. Please join us next week as we discuss planning for a baby shower.